Oh, hi. I didn't see you there. I'm Trevin Stratton, the chief economist at the Canadian Chamber of Commerce. And recently I've been looking into and reading a lot about the anatomy of economic downturns. And so obviously we've heard a lot of analogies over the past month about comparisons to 2008, comparisons to the Great Depression, 2009. Something I think that is important to keep in mind when we're thinking about what we are currently experiencing is that there are different types of economic crises or different catalysts for them. Certainly there are downturns that took place, but what caused them tend to be different sometimes. And so what's really different about what we're experiencing right now compared to 2008 or to 1929 is that in those previous crises, we saw a financial crisis or a credit crisis, right? Where there was a lack of money and credit for banks and other financial institutions. There was an initial stock market crash that then had reverberations throughout the real economy. There are other types of crises, right? There are fiscal crises or debt crises where governments are unable to meet their payments. There are currency crises with a rapid fall in the value of different currencies. There's hyperinflation and tied to that stagflation like we saw in the early 1980s. But what we're currently experiencing is something quite unique. It's a health pandemic that then has reverberations throughout the real economy because of its impact. And that's happened in a couple of different ways. First of all is a supply shock, that it has impacted our actual supply chains and what's available and the efficiencies that we've produced throughout many decades, both within Canada and globally. And secondly, it's also created a demand shock. Where if people are working from home, they might not be purchasing or consuming as much. They might feel uncertain about their economic situation, so they're not buying as much because of that. And then that has a negative impact on the economy. Now, when we're looking at the numbers, first of all, I'd say that the uncertainty surrounding any economic outlook is exceptionally high. We don't necessarily know how this will pan out when it comes to economic projections, because a lot of it will rely on the timing and strength the timing and strength of economic recovery will depend on how the pandemic unfolds and what measures are required to contain it. But at least the initial numbers when we're looking at it, Statistics Canada had a flash estimate that our GDP, the size of our economy, declined by 9% in March. And this would be the largest one-month decline in GDP since they started collecting data on the series in 1961. And this is in line that Canada lost, 1 million jobs in March. The unemployment rate increased by 2.2 percentage points, being the largest one-month increase since comparable data became available as well. And apart from that, we were also seeing over 2 million workers reporting fewer than usual hours or none at all. If we look ahead, over the next 3 months or the second quarter of this year, the Bank of Canada expects to see a growth decline between 15 and 30% compared to the last quarter of 2019. And looking forward to the whole year, global output is supposed to decline by 3% in 2020, and the Canadian economy is supposed to decline by 6.2% based on the International Monetary Fund's projection. And then there is supposed to be general rebounds both globally and within Canada next year in 2021. What does this mean when it comes to the anatomy of a crisis? Well, when it comes to recovery, we're really going to need to figure out how to ramp up those demand and supply issues once the health crisis abates. Part of that will certainly be getting people back to work as soon as possible. Part of it will be helping to restore and maintain supply chains, even though we may be seeing globally pushes toward nearshoring and onshoring and the deterioration of some global supply chains. But when it comes to recovery, these are going to be the aspects that we're going to have to keep in mind to try to get as close as possible to a swift recovery and avoid an L-shaped one.